From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Before we begin today, we have got some news that we need to share with all of you, and I will begin our program today by reading a message that Dr. Pate asked that we share with all of you. I wish that I could be with all of you today, but on Monday, I suddenly and unexpectedly lost my best friend and my soulmate to what appears to have been a heart attack. My wife, Lynette, and I would have celebrated our 45th wedding anniversary this September. Fortunately, we had a very special day on Sunday, the day before she passed away. For our last anniversary, Lynette surprised me with a used Volkswagen Beetle convertible, the same kind and color of my first car that I would drive her in on our dates. The battery had died due to lack of use over the winter months, but Sunday was so beautiful. I replaced the battery, got the car running, and told her, let's go for a ride. I helped her to the car, had the top down, and we drove to the park and got ice cream on the way home. I placed my hand on her thigh and I told her, this is just like it was 48 years ago. That night, I helped her into bed. I tucked her in, gave her a kiss and a hug, and I told her I loved her and I would see her in the morning. Her last words to me were, I love you too. I realized that not everyone is as fortunate as I was to have such an amazing person in my life for so long who wanted to spend every minute with me, but knew that it was in my core to help people and that I couldn't help fighting for truth and supporting the wonderful doctors and healthcare professionals on the front lines. She was my constant support and my brutally honest critic who constantly made me a better man and a better doctor. Right now, I have to figure out life without her by my side. She was one of a kind, but she left me with 2 wonderful daughters and 5 amazing grandchildren to love and surround me. I have also been overwhelmed by the small acts of kindness from so many people that mean so much at a time like this. The thanks and the stories so many of you have shared with me over the past 5 years from my efforts to educate the public and help you all navigate public health threats has encouraged me and kept me going. And I look forward to rejoining you in a couple of weeks once I can think straight enough to continue this important work. Until then, tell those you love how much you love them. Do something kind for someone. And please continue to listen and support this programming. I am grateful to my dear friend, amazing colleague, and fantastic co-author, Dr. Ted Epperly, for stepping in for me. I'll be back soon. So with that, I would like to bring in Dr. Ted Epperly. He is, of course, the co-author of the book with Dr. Pate, Preparing for the Next Global Outbreak. He is also the president and CEO of Full Circle Health, located here in the Treasure Valley. Dr. Epperly, thank you so much for stepping in on such short notice in really heartbreaking circumstances.
Thank you, Jim. It's an honor to be with you. And I just wanted to say I'm also very deeply saddened at the loss of David's wonderful wife, Lynette, who I knew as well. She'll be sorely missed by David and their family.
And it was such a shock to I know all of us, and we are all thinking of Dr. Pate. So all of our listeners, please keep him in your thoughts, in your prayers over the next few weeks as he navigates this new normal. With that said, Dr. Epperly, we do have a lot to get to today, and we so appreciate you stepping in. And so I want to start our conversation today with the news that Health and Human Services Secretary Robert Kennedy Jr. will require new vaccines to undergo placebo-controlled trials. Now, my first question for you is, don't we already do this?
Yes, Gemma, we've been doing vaccine-controlled safety trials, not only for vaccine, but for drugs and medications for a long time in the United States. That is the gold standard. We're very careful about the development of vaccines and rolling that out to the public. Placebo-controlled trials are uniformly done for all of them. So it is a shocking announcement. I think it is one that is going to slow down vaccine development. Most of the concern right now is what exactly is meant by a new vaccine. We've got all sorts of vaccines that have been around for a long time. So it's going to be interesting to see how this plays out. And it's going to be, unfortunately, extremely costly to the American public to fund a lot of vaccine trials that we've already proven to be safe.
So, can we talk a little bit deeper about this? Because I'm thinking about the annual flu shot that comes out, and now we know we have to update the COVID vaccine yearly. Uh, do we know if these will be considered new vaccines? Because the flu shot isn't always the same strain of flu shot every year.
Right. It's a great point. It is unclear at this point if this is going to be focused on both the annual flu vaccine and the annual COVID vaccine updates. My sense of this is that it will probably not be applied to influenza. We have 80
Hmm.
years worth of vaccine trials for influenza, and it is such a rapidly evolving virus that each year, as our listeners know, there are usually 3 to 4 strains that get put into the new vaccine so that we can keep it current with what's happening in the world. If this were to be the case, however, that indeed every new vaccine, which would mean the annual flu vaccine, were to have this applied, it would greatly slow down both the production of this vaccine and would lead to many unnecessary infections, hospitalizations, and deaths. I did want to add one thought to what it might mean for COVID vaccines.
Hmm.
I think that's probably the intended target, is to really stop the development of COVID vaccines. As you know, it's even more rapidly evolving than influenza. That's why we've talked about a every 6 month to year update on COVID. I have a feeling that this is exactly what will happen with COVID, which will really kind of take it offline. And I think that's probably an intended outcome of this.
Okay, so with that said, Dr. Apperly, and you are not the only health expert who is concerned about this and focusing on the COVID vaccine. Oh, I mean, if you choose not to get the COVID vaccine, don't get the COVID vaccine. But there are those of us who want to stay updated with the COVID vaccine. And couldn't it all of a sudden then not make it available for people who want to get it? But secondly, COVID is still here. So if there isn't an updated vaccine, what could that potentially mean moving forward when it comes to people getting COVID, people being hospitalized for COVID? I mean, I see this domino effect in a way, if that makes sense.
Oh, it sure does, Gemma, and you're spot on. This, for people who want to get the COVID vaccine, will take that possibility and choice away from them. It's antithetical to a good public health system that's trying to help ensure people's health. It's not a mandate across the United States that people get COVID shots, but for many who do, immunocompromised people, people that are concerned about getting COVID or long COVID, that choice should be available for them. So to make this kind of proclamation at a federal level takes choice away from people. Not only does it take choice away, but it'll increase again both infections, hospitalizations, death, long COVID, and other downstream consequences that really go against what public health really stands for.
Mhm. And is this good practice when, as you said, we already know that certain vaccines are safe and effective? They're tried and true. You mentioned the flu vaccine. The flu shot, 80 years, right? But what about something like the MMR vaccine, which is, become controversial, but again, has been around, what, more than 50 years, I think.
Yes, the first MMR vaccine was developed in 1963. At that time, it was a killed virus vaccine. In 1971, it became a weakened or attenuated live virus vaccine. The measles virus is very slowly evolving. So we don't need to have a yearly update with different types of strains. It's exactly the same as it's been. So we have again since 1963 data on measles and measles vaccines. They are incredibly safe to the public. So it would be unethical to now slow down, if you will, measles vaccine production to do a placebo controlled trial on something that has been already established as safe and effective for the American public. So it's like I say, this is just something that does not make sense and in many ways could border on being even unethical.
I do want to talk now about the measles. The CDC has now confirmed that there are more than 900 cases in the United States and 29 states. 6 of those states are now reporting outbreaks. So, Dr. Epperly, Idaho is not one of those states reporting any measles cases. But what's the likelihood that's going to change?
I think it's very likely that it will happen, Gemma. There have been cases reported in states around us, Washington and Montana most notably. The big deal here with measles in Idaho is, Idaho is kind of, off the beaten track for a lot of
Hmm.
travelers. And that's probably why Idaho hasn't seen much yet. But high density areas where there's a lot of travel, Sun Valley, Coeur d'Alene, Boise, those are places that will start to experience it. Now, a lot with measles outbreaks is due to the herd immunity or the background immunity in the population. For measles,
Hmm.
that needs to be high. It needs to be about 95% or so of the community needs to be vaccinated for measles not to find a foothold in that community. I just want to remind our listeners that measles is the most infectious virus on the planet. There is nothing more contagious than measles. One person that has it can spread it to 17 other people. Take, for instance, influenza. One person can spread it to 3 people. In the height of the COVID pandemic, one person could spread it to 3 or even up to 7 people. This is spread to around 17 people. So, in communities where there is a vaccination rate less than 95%, this virus will find those people. And there are pockets of Idaho, both in terms of individuals and populations of individuals, that are well below 95% vaccination rates. Northern Idaho
Hmm.
comes really dramatically to mind. What's going to happen in Idaho is we will start to get infections, and that infection will find its way into those individuals and groups of individuals that have low vaccination rate. But as opposed, and I'll stop with this next comment, Gemma, but as opposed to COVID, which was a sweeping forest fire, it was a novel virus.
Hmm.
Nobody had any immunity to COVID. It spread like a wildfire across the entire planet. What's going to happen with measles? It's going to smolder. It's not going to be a big forest fire. It'll be small, smoldering outbreaks. It will only be in those populations where the herd immunity is much less than 95%. So it will happen. It will happen where there are low vaccination rates in the surrounding population. Those that have chose not to get vaccinated or their children to get vaccinated are going to be the ones that end up with this.
So you mentioned like high density areas, right? Highly traveled areas. We are now getting reports of people infected with measles being in these highly congested areas. For example, a professional baseball game. There was a person who was at a baseball game who had the measles. There was an infant with the measles who traveled through SeaTac Airport in Seattle at the end of March. So, Dr. Epperly, with summer travel season just around the corner, what do people need to know about this to stay healthy? Because I mean, especially when you fly out of Boise, very rarely do you have a direct flight. I think almost every flight, my family and I take, we always connect through SeaTac.
Yeah, it's a great point, Gemma. The best thing that people can do to ensure that you stay safe and your loved ones stay safe is to get vaccinated. So, what the CDC recommends for vaccination for measles is for those born before 1957, you don't need to get vaccinated. The contagion rate of measles back in those times was high enough that it is taken on great faith that you more than likely
Mm,
were exposed. Now, a person can get a blood titer test, though, for measles and to see if that's the case. If they prove not to have been infected by measles at any time, no titer positivity, then they should get vaccinated. I will say that if you've been exposed to measles or if you've had two-dose vaccine, it is a universal lifetime vaccine. You don't have to get updates or booster shots for measles. Um, and the CDC now recommends, of course, a two-dose vaccine series for kids. The first one being 12 to 15 months of age, the second one between 4 and 6 years of age. That will provide what is felt to be universal protectivity. Now, that doesn't necessarily mean, Gemma, that you may not contract measles, but if you do, the
mm,
symptoms will be so mild. What vaccines protect against, and it's important for the listeners to understand this, it's not total immunity from ever getting an infection, it's from getting really sick or dying from an infection. So, the best thing that individuals can do, especially during the summer months as we all start to travel more, is to make sure that you are vaccinated, your loved ones are vaccinated. If you're not sure, then you can get a measles blood titer test drawn and you can receive a vaccine. It's extremely safe to get the measles vaccine. It has been totally debunked that this leads to autism and other serious problems. And so I just want to assure the listeners of that. Now, there's one other important point I want to make, and this ties to the baseball game at the Texas Rangers game and
mm,
the infant at SeaTac Airport. And that is that measles virus as a particulate suspended in air can stay in an area for up to 2 hours. So if there was a measles child or infant in this case
mm,
that was in a room or in a restaurant, the particulate matter of that child, in terms of breathing in and out, can be in that room for up to 2 hours of time. In other words, you can, if you're now unvaccinated, you can then walk into that same room and have a 90% chance of getting it. That's how contagious measles is for unvaccinated people. About 90% of people who come across it will get it. Now, if actually one last point, if a
mm,
parent is traveling this summer and your child is less than 12 months, because again, remember the vaccination start for measles is between 12 and 15 months. You can actually go in and get this test at get this vaccine at any time after 6 months of life. So if you've got a young child between 6 and 12 months and you're going to be traveling either, through airports or internationally, you can have
mm.
that vaccine given early to your child, which will confer with a single dose about a 93% protective rate. With two doses, that gets to 97% protection.
And Dr. Epperly, I just want to make the point again that if you are fully vaccinated against the measles, as you said, that doesn't necessarily mean you won't get the measles if you come in contact with someone, but it is not something we need to be that concerned with. And I ask this just personally because I'm going to be traveling this summer. So are my husband and my kids with me, and we're vaccinated. But I think a lot of people are probably maybe becoming a bit more concerned, even if they are fully vaccinated.
Yes, that is true. I would almost tell you across the board, Gemma, that if you were to come across measles with your travels with you and your family this summer, though, being fully vaccinated is going to keep you all from really getting sick and definitely going to protect you from having a hospitalization or death. The symptoms may be even so mild that people don't know about that. So, despite the
Mm,
fact that we've got now over 900 cases, I can almost guarantee you that there's a whole lot more infections out there than that. People just don't know it, or they haven't reported it, or they haven't gone in for it. So, it's a bigger problem than we actually recognize. And like I say, because of this smoldering action of measles, it'll spread slowly, more slowly, not like COVID, where it spread rapidly. It's going to spread really slowly over time to all sorts of places, and it's going to find those people that have not been vaccinated.
Dr. Epperly, I want to talk now about the numbers of flu deaths. The CDC has brought this report to our attention, saying it's the highest flu deaths in children in the most they've seen in 15 years. We're talking 216 deaths this last flu season. So was this just a particularly bad flu season, or is there another reason as to why we've seen such a high death rate in children?
Yeah, it's a great question, Gemma. What is happening across the United States and even across the world is vaccination rates are dropping. So, for instance, just here in the United States, we've dropped from 64% of the public being vaccinated for influenza to now this year less than 49% of people.
Oh, wow.
Influenza has always been a serious problem. It typically leads to hundreds of millions of infections per year across both the United States and much greater numbers across the world. It typically annually leads to about 40 to 50,000 deaths. People just kind of blow it off as the annual influenza. It can be an incredibly serious problem. So again, if you couple an already rapidly evolving virus each year, that's why we get the annual update that is can make people really sick. I'll tell you, I had annual flu vaccines. I missed it one year back in the mid 90s, and I got as sick as a dog. I was the
Mm-hmm.
sickest, Gemma, I've ever been in my life. I was flat on my back for 5 days from influenza. And that was when I was in my early 40s. And so I can only imagine getting influenza as an 80-year-old or as an 8-month old if you're not vaccinated. It's going to kick your butt. And so the combination of an already serious virus coupled with low vaccination rates is the toxic mixture that we're seeing for
Mm.
why there's increased children's deaths.
And circling back to our very first discussion point in the last segment, Dr. Epperly, if the flu shot has to go under this new placebo testing, how concerned are you that we'll see another flu season like this?
Oh, that is exactly what will happen. If the placebo testing now gets in the way to stop a fairly rapid annual production of flu virus in terms of getting the right strains together and then stopping that to placebo tested. In other words, half of people get the vaccine, half get a saline placebo injection. This is really going to halt production, slow it way down. We'll be way behind the annual curve on this. And what that'll lead to is increased hospitalizations, increased sicknesses, increased deaths. We will see that across the board, not only in kids and infants, we'll see it in adults and older people too.
Mm. Before I let you go, Dr. Epperle, I want to talk quickly about the CDC closing its HIV self-testing program, basically because they don't have enough staff for oversight. Can you tell us about this?
Yes, this is a tragic outcome of, I think, overreach on the federal government's part to start to lay off people and close programs. This one was a CDC sponsored program with Emory University, which is located in Atlanta. And what they were doing was developing HIV tests that could be a household test. In other words, just like COVID testing can be done now in the home easily, these were household home tests that could be done and give results within 20 minutes. So people would know if they were HIV positive or not. I just remind everybody that the CDC recommends that all Americans between ages 13 and 64 be tested for HIV at least once in their lifetime. So this was a way to try to increase the number of people, because only about 25% of Americans have been tested for HIV, to make sure that you're safe from this. that rolled this out, 750,000 of these. They had identified, because of these tests, 7,000 individuals that did not know they had HIV. And from their modeling and calculation, they figured out that there were 500 people that they've saved from developing HIV by making sure those 7,000 now knew that they did. There's unbelievable cost savings in catching this early and helping with prevention versus having people develop full-blown HIV, which, as we know, is a chronic, ongoing disease that used to be uniformly fatal. Now, with appropriate medication, can be well treated. But here is an example again of being penny wise and pound foolish. If you're going to stop a program like this that's having major impact on Americans across the country for cost saving reasons, which is what happened here, the CDC then didn't have enough employees to oversee this program. They just shut the whole thing down. And that's going to hurt people in the long run, Gemma.
Well, Dr. Epperly, we so appreciate you taking time today to talk with us. We've been speaking with Dr. Ted Epperly. He is the president and CEO of Full Circle Health, which is located in the Treasure Valley. He is also the co-author of the book, Preparing for the Next Global Outbreak. Dr. Epperly has been kind enough to step in and fill in for Dr. Pate while he takes time away from the program to mourn the loss of his wife. Dr. Epperly will be back with us next week. So if you do have public health questions, send them our way. Idaho Matters at boisestate.edu. I'm Gemma Gaudette, and this is Idaho Matters.